We all know oxygen as, well, what keeps us going, right? Breathe in, breathe out.
Yeah.
Simple.
Fundamental.
But get this. You crank up the pressure and the concentration like they do in hyperbaric oxygen therapy, and suddenly that same oxygen, it starts acting like a really powerful drug. And it can have some pretty surprising interactions with other medications.
That's absolutely the fascinating reality of hyperbaric oxygen therapy, or HBO. Yeah. We're talking about breathing 100% pure oxygen inside a special chamber, you know, at pressures much higher than just normal air pressure.
Right.
And this literally floods the body with oxygen, which, while it can be incredibly therapeutic for certain conditions.
It also means we really need to understand how this oxygen drug, let's call it, might play with other actual drugs you might be taking.
Precisely.
So today on the Deep Dives, we're going to sift through the scientific literature to get a handle on these potential interactions. Think of this as like your quick guide to a pretty crucial area, especially if HBO is something you're looking at, or maybe someone you know is considering it. We'll unpack what happens when this high-dose oxygen meets common medications. Everything from stuff affecting your brain to things fighting infections or even cancer.
And this knowledge is, well, it's vital. Just like any medication, HBO has this potential to either, boost or weaken the effects of other drugs. By understanding these dynamics, we can aim to, hopefully, prevent unwanted side effects and maybe even find ways to make treatments more effective when they're combined with HBO.
Exactly. So we'll be exploring how HBO might interact with drugs that hit the central nervous system, antimicrobials, those powerful agents used in cancer therapy, and medications for your heart and blood vessels, too.
Right.
We'll also touch on the practical side, like how do you even give medications during HBO, and even look at substances that can either make oxygen toxicity worse or maybe offer some protection against it.
A lot to cover.
Yeah, this is about getting you informed on a complex topic, drawing straight from the research.
So our goal today is really to navigate this pretty intricate field using the scientific literature directly to give you some valuable insights. Let's start with the core concept. Just recognizing oxygen itself as a drug under these specific conditions.
Okay, let's unpack that. I mean, it sounds obvious maybe, but when you're inhaling pure oxygen under pressure, it really does cross over into pharmacology, doesn't it?
It absolutely does. It's not just the air we normally breathe. It becomes an active pharmacological agent in your body's systems.
Right.
And the moment you introduce another active player, like a pharmaceutical drug, you immediately create the potential for interactions. And these aren't always simple or predictable, which is why the research here is so important and, frankly, ongoing.
And these interactions, they're not all the same, are they? It's not just one mechanism.
That's correct. We usually break drug interactions down into three main types. First, you've got pharmacokinetic interactions. Think kinetic movement. This type affects how a drug moves through your body, how it's absorbed, where it goes, how it gets broken down, and how it leaves. HBO might change these processes, leading to, say, higher or lower levels of the other drug than you'd expect.
That makes sense. Like, if HBO makes your body break down a drug faster, you might not get the full effect. Or if it slows it down, maybe too much builds up, could cause side effects.
Exactly. That's pharmacokinetics. Then the second type is pharmacodynamic interactions. Dynamic is about power or effect.
Right.
These happen right where the drug actually does its job, often by binding to receptors on your cells. HBO could potentially influence how sensitive those receptors are or how well the drug can actually latch onto them.
So even if the drug level in the blood is the same, HBO could make it work better or worse at the target site. Interesting. And the third type?
The third is idiosyncratic interactions. These are honestly the trickiest ones because they're unpredictable. They tend to happen only in a few people, and the reasons why are often unclear. Maybe something to do with an individual's unique genetic makeup or physiology.
The real curveballs. So, okay, HBO can really mess with how other meds work in several ways.
Yeah.
You mentioned a statistic earlier that kind of highlighted the scale of this. Something about a review finding lots of interactions.
Yes, that's right. A review back in 2011 documented potential interactions between HBO and 38 out of 69 commonly prescribed drugs they looked at.
Wow, 38 out of 69. That's more than half.
Yeah, it really underlines how widespread this issue could be and why it's so crucial for doctors and pharmacists to get a complete medication list before someone starts HBO therapy.
Absolutely. Okay, let's dig into some specific drug types. It seems like one area where HBO often has a positive interaction is with antimicrobials, the infection fighters.
That often seems to be the case, yes.
Yep.
HBO itself actually has some antimicrobial properties. It likely boosts the production of reactive oxygen species, free radicals, which can damage and kill microbes.
Yeah.
So in many situations, HBO seems to enhance how well antibiotics work. It's like adding another weapon to the fight.
Interesting, like a boosted defense. You mentioned a specific one, imipenem, and a study on burn wounds.
Yes, there was a 2015 lab study, an in vitro study. They looked at imipenem against Pseudomonas aeruginosa, which is a nasty bug often found in burn wounds.
Right.
They found that when they combined HBO, specifically 100% oxygen, at 3 times normal pressure, 3 ATA, for 5 hours with imipenem, it significantly boosted the antibiotic's killing power against several strains of that bacteria.
And how did it do that? What was the mechanism?
Well, the study suggested that the HBO likely ramped up the production of something called superoxide anions by immune cells, macrophages. And these superoxide anions probably helped kill the bacteria through oxidative damage.
Okay.
So it points to a real potential benefit for patients fighting those kinds of infections, maybe using HBO alongside the antibiotic.
Sounds promising for tough infections like that. What about other antibiotics, like aminoglycosides, tobramycin, gentamicin?
Yeah, the data there is a bit more mixed. Studies in rabbits showed HBO didn't really change how much tobramycin got into the cerebrospinal fluid, the CSF, which is important if you're treating, say, meningitis. Interestingly, carbon dioxide did affect that transfer. And in healthy human volunteers, HBO didn't seem to change the pharmacokinetics, how the body handles gentamicin.
So for those specific ones, maybe not a huge impact from HBO on drug levels. Okay, what about sulfonamides?
Sulfonamides. They're usually bacteriostatic, meaning they stop bacteria from multiplying, but don't necessarily kill them outright.
Right.
But when you add the high oxygen levels of HBO, it seems to create a synergistic bactericidal effect. The high oxygen helps the sulfonamide actually kill the bacteria directly.
Wow, so it changes how they fundamentally work. Now, there was one antimicrobial you mentioned that should not be used with HBO, right? Mafenide acetate, sulfamylon?
Yes, absolutely. Mafenide acetate or sulfamylon cream, often used for burns. It's also a carbonic anhydrase inhibitor, meaning it can cause carbon dioxide to build up in the body and make blood vessels widen. And that's a problem during HBO because it could potentially increase the risk of oxygen toxicity. So the standard advice is to stop using sulfamylon before starting HBO.
Okay, good to know. A clear, don't mix these two.
Yeah.
Let's switch gears to anti-cancer agents. This sounds really intricate, especially because tumors often have those low oxygen areas, the hypoxia.
It is complex, yeah.
Yeah.
But a key idea here is that HBO can help overcome that tumor hypoxia. Lack of oxygen makes tumors resistant to both radiation and many chemotherapies.
Right.
So by pumping more oxygen into the tumor tissue, HBO can potentially make those standard treatments work better. Getting past that hypoxia is a major goal.
It's like making the cancer cells more vulnerable again. What have studies shown with specific chemo drugs? Let's start with adriamycin.
Okay, adriamycin. With that one, if cells got HBO at the same time as the drug, it actually seemed to decrease the drug's cancer-killing ability.
Oh, interesting. Opposite effect.
Yeah, but if the cells got the adriamycin a few hours before or after the HBO treatment, then the drug's effect was increased.
Wow, so timing is absolutely critical there.
It really seems to be, for that drug at least.
Okay, what about nitrogen mustard, another chemotherapy agent?
With nitrogen mustard, the study showed its cytotoxicity. Its cell-killing power went up when cells got HBO, whether it was before, during, or after the drug. A different pattern.
Okay, so HBO seemed helpful regardless of timing there. You also mentioned doxorubicin, another big chemo drug, and there's some history there, a concern.
Yes, exactly. Historically, using doxorubicin concurrently with HBO was seen as a potential issue because of worries about increased damage to the heart cardiotoxicity. Doxorubicin can be hard on the heart anyway.
Right, a serious concern.
But here's where it gets interesting. Preclinical studies in cell cultures in animals have actually shown HBO can enhance doxorubicin's anti-cancer effect. And HBO is also shown to reduce the breakdown of another drug, mefenide, which makes cancer cells more sensitive to radiation, so potentially boosting radiotherapy too.
But what about that heart risk? Has that been resolved?
Well, maybe not resolved, but challenged. A more recent experimental study, this one in rats, actually suggested that HBO exposure did not worsen the heart damage caused by doxorubicin. In fact, it might have even offered some protection.
In rats. Okay.
In rats, yeah.
Yeah.
So promising, but definitely needs more investigation in humans before we change clinical practice. It does suggest we might need to reevaluate that long-standing contraindication, though.
That's potentially huge. What about newer drugs like sorfinib? used for liver cancer.
Right, sorafenib. It's a first-line treatment for hepatocellular carcinoma, liver cancer. But it doesn't work for everyone, and sometimes it can even make the tumor hypoxia worse.
Oh.
So a study looked at combining HBO with sorafenib in liver cancer cell lines, and they found a synergistic effect, meaning the combo inhibited cancer cell growth and triggered cell death much more effectively than you'd expect from just adding the effects of each one separately.
That sounds very encouraging for liver cancer treatment.
It does. The researchers also saw big changes in microRNAs, these little regulatory molecules, suggesting how HBO might be boosting sorafenib's action. In that study, they used HBO at 2 ATA for 80 minutes daily.
Okay, let's shift again. Cardiovascular drugs, meds for the heart and blood vessels. Sounds like HBO can really shake things up here, too.
Oh, absolutely. If you look at things like adrenolytic, and ganglion-blocking agents, basically drugs affecting blood pressure and heart rate, HBO seems to have quite an impact.
How so?
Well, it can significantly reduce the blood pressure-lowering effects of common meds, like alpha and beta blockers, ganglion blockers, and beta agonists. It can even apparently wipe out the effects of some drugs that work in the brain to lower blood pressure.
So if you're on blood pressure meds, HBO might temporarily counteract them.
That seems to be the gist, yes. And conversely, HBO can strengthen the blood pressure-raising effects of drugs that stimulate alpha receptors and also enhance the heart-slowing effects of beta blockers. Because of all this, the general advice is that these kinds of cardiovascular drugs should ideally be given after an HBO session, not right before.
That's a really crucial practical point for patients on those meds. What about digitalis or digoxin? Used for heart failure, a fib?
Yeah, there were reports suggesting HBO might make cardiac glycosides like digoxin less effective. But interestingly, there's also some, albeit limited, evidence that HBO might actually reduce their toxic side effects. Needs more digging, though.
Complex. And for people with angina, chest pain, taking anti-anginal drugs.
A study looked at patients with ischemic heart disease. They found a single HBO section, 1.5 ATA for 40 minutes. It reduced some of the indirect blood flow effects of nifedipine, the calcium channel blocker.
Okay.
It also seemed to enhance the heart-slowing and force-reducing effects of propranolol, but didn't seem to affect long-acting nitroglycerin much. So again, it depends on the specific drug.
Not a one-size-fits-all interaction there either. Lastly, in this category, what about heparin, the blood thinner?
Right. Experimental studies in animals treated with heparin and then put under very high pressure for long times showed bleeding in the lungs.
Yikes.
Yeah. The thought was it's the combo of blood thinning plus potential lung irritation from the intense oxygen exposure. But, and this is important, the pressures and times in those animal studies were way beyond typical human clinical HBO.
Okay.
While complications haven't been widely reported in humans on heparin getting standard HBO, it's still something to be aware of, err on the side of caution.
Makes sense. Okay, let's turn to drugs affecting the central nervous system, the CNS. Always a sensitive area. We touched on anesthetics, but what else?
Well, CNS stimulants, like amphetamines, they generally don't mix well with HBO. They might increase the risk of oxygen toxicity. And interestingly, even too much caffeine in people who are sensitive might nudge them towards that risk too.
So maybe skip the giant coffee before hopping in the chamber.
Probably wise, yeah.
What about alcohol, ethanol?
Well, hyperbaric air, not pure oxygen, seem to work with ethanol to make mice sleep longer, which might explain why people who've been drinking could be more affected by pressure changes, like during diving. But there's zero evidence HBO helps you sober up faster, and it doesn't seem to cause specific problems for intoxicated folks getting HBO for, say, carbon monoxide poisoning.
Good to clarify, HBO is not a hangover cure. What about narcotic painkillers like morphine, fentanyl? They affect breathing, right?
They do, significantly. Narcotics tend to depress respiration, making the brain less sensitive to CO2 buildup. Combine that with HBO, which can sometimes also affect breathing patterns.
You could get too much CO2.
Potentially, yeah. A rise in PaCO2, the carbon dioxide level in arterial blood. And higher CO2 can dilate blood vessels in the brain, which, counterintuitively, might increase the risk of oxygen toxicity. Now, studies in dogs didn't show big changes in how iperidine or morphine worked with HBO, but translating directly from dogs to humans. You have to be cautious.
Right. So a potential added risk from the combined breathing effects. What about pentobarbital, a barbiturate sedative?
Interestingly, studies in dogs showed HBO didn't really change the pharmacokinetics of pentobarbital, how fast it's cleared, where it goes in the body.
Okay.
So when pentobarbital sedative effects are sometimes reversed under pressure, it's probably not because the drug levels changed. It's more likely due to how the drug interacts with the brain under pressure, a different mechanism.
Subtle but important difference. And lastly, for CNS, scopolamine for motion sickness.
Yeah, scopolamine can be used with HBO, especially for divers. Rat studies at pretty high pressure 5-ATA didn't show it made oxygen seizures happen faster. But you still need to watch out for its usual side effects like vision changes or heart rate effects. The transdermal patches seemed okay at pressures over 2 ATA.
Okay, let's move through some miscellaneous drugs quickly. Insulin for diabetes.
Yes, important one. Patients might need less insulin during HBO therapy. HBO can sometimes lower blood sugar or increase insulin sensitivity. Needs careful monitoring. Good to know for diabetic patients. What about losartan? It's a blood pressure med, but also used for kidney issues.
Yeah, an experimental study in a model of a kidney disorder called nephrotic syndrome found that adding HBO to losartan actually boosted the drug's effectiveness. It helped reduce protein in the urine, which is a key marker, so a potentially beneficial combo there.
Interesting synergy. What about reserpine and guanethidine? Older blood pressure drugs?
Those have been shown to interact unfavorably with HBO. The sources didn't detail exactly how, but flagged them as problematic.
Okay. And common things like salicylates, aspirin.
A dog study showed salicylates cleared faster at high pressure, 2.8 ATA, but frustratingly, no human studies. So we don't know if that applies to people.
Another question mark for humans, and theophylline. For asthma, COPD.
Similar story, no effect on its pharmacokinetics in dogs at 2.8 ATA, but again, no human data really highlights where the research gaps are.
It really does. Okay, let's talk practicalities. Giving drugs during HBO. That pressurized chamber must pose challenges. It certainly does. You have to think about the physics. If you're storing meds inside a multi-place chamber, one holding several people, they need to be in pressure-proof containers, especially if they go through multiple pressure cycles.
Right. Don't want things breaking or leaking.
Exactly. Good news is small glass vials usually don't explode below about 3 ATA, but those multi-dose vials with rubber tops, probably best to use them only once inside the chamber to avoid contamination risk when you puncture the stopper repeatedly in that environment.
Makes total sense. Safety first. What are those pump things, the elastomeric infusers that give meds slowly IV?
Yeah, those are more common now. Patients might need them during HBO. One study looked at a specific Baxter infuser model under pressure, around 2.4 times normal.
Yeah.
Then they found no significant difference in the delivery rate compared to normal pressure. So for that device, at least, the pressure didn't seem to mess with its function.
Good to know some tech holds up. Now let's flip the coin. Drugs that can actually make oxygen toxicity worse. This sounds critical.
Absolutely crucial. Acetazolamide, that carbonic anhydrase inhibitor we mentioned before with Mafenide.
Yeah.
Normally, high oxygen makes brain blood vessels constrict, a protective reflex. Acetazolamide blocks that constriction. So you get more blood flow to the brain, potentially delivering too much oxygen at pressures over 2 ATA. It undermines a natural defense.
Wow, it blocks the body's own protection. We also mentioned CNS stimulants again here.
Yes, stimulants like amphetamines increase the risk, and disulfiram, the drug used for alcohol dependence, one of its breakdown products might inhibit a key antioxidant enzyme, superoxide dismutase. Less antioxidant defense could mean more damage from oxygen-free radicals.
Complex biochemistry there. What about perfluorocarbon, PFC, sometimes used for decompression sickness?
Interesting one. A rat study at very high pressure, 6 ATA, found that intravenous PFC made abnormal brain electrical activity, like seizures, happen faster. No. It also increased markers of oxidative stress and nitric oxide and lowered antioxidant enzyme activity in the brain.
Yeah.
But an antioxidant drug called edaravone seemed to protect against this.
So PFC at high pressure might be risky, but antioxidants could help.
That's the suggestion from that study, yeah. High-pressure PFC might promote CNS oxygen toxicity.
And lastly, thyroid extract.
Yes, animal studies show thyroid hormone increases oxygen toxicity, probably because it ramps up the body's metabolic rate, making it more prone to seizures from the oxygen. And it's generally assumed this could apply to humans too.
Okay, a vital list of things to be cautious about. Now, the other side. Are there drugs that might actually protect against oxygen toxicity?
Yeah, this is a big area of interest. Anticonvulsants like phenytoin and diazepam, they treat the seizures if they happen, but they don't necessarily prevent the underlying oxygen damage itself.
Treating the symptom, not the cause.
Pretty much. Barbiturates might offer some protection, but they suppress breathing, which is a problem. Diazepam and lorazepam are standard for non-HBO seizures, but again, they don't stop the oxygen toxicity and can affect breathing. There's even a warning about using phenytoin with long, high-pressure oxygen exposures, as you could get CNS toxicity without a seizure warning. Carbamazepine, though, seems useful for preventing CNS toxicity during HBO in seizure-prone patients.
So carbamazepine might be a better bet there. What about ergot derivatives?
Fluozuride and quinpiral, two ergot derivatives, reduced HBO seizures in mice, about half as effective as diazepam.
Right.
But no reports of using them in people for this purpose yet.
Interesting animal data, lidocaine, the local anesthetic.
Yeah, in doses lower than what would cause a seizure itself, lidocaine seems to have a neuroprotective effect against HBO's CNS toxicity. We don't know exactly why. Maybe it affects brain chemicals or calms down nerve cell excitability somehow.
So it might soothe the nervous system against the oxygen stress. Magnesium, like Epsom salts, but injectable.
Yes, magnesium sulfate. Magnesium ions have antioxidant effects and can dilate blood vessels, both of which could help reduce oxygen toxicity. Some suggest maybe a single dose about 3 hours before HBO might help.
Okay. Phenolthiazines, like chlorpromazine.
Chlorpromazine is generally considered protective against oxygen toxicity, though the specifics of how weren't in our sources.
And topropanol, the beta blocker.
Elpropanol specifically protected mice against HBO seizures, but again, no clinical reports of using it this way in humans yet.
And finally, the classic antioxidant, vitamin E.
Yep. The idea is it directly fights those damaging oxygen-free radicals. A suggested dose is maybe 400 milligrams daily, starting a couple of days before therapy as a possible protective measure.
This has been, wow, an incredibly thorough deep dive into a really complex subject. So to wrap up the key points, it really sounds like drug interactions with HBO aren't just a possibility. They're pretty significant and need real attention.
Absolutely. I think the crucial takeaway for everyone listening is that healthcare professionals absolutely must get a thorough, accurate medication history from anyone considering or undergoing HBO. We've seen how HBO can change how drugs work and how drugs can change the body's response to HBO.
Yeah.
It goes both ways.
And as we kept saying, there's clearly a big need for more research, especially good studies in humans, right? To build a really solid, reliable list of what interacts, how, and why.
That's exactly right. Such a resource would be incredibly valuable for doctors, pharmacists, everyone involved in patient care to ensure safety and get the best results from both the HBO and any other meds. It's a field that's definitely still evolving.
So here's a final thought for you, our listener, to chew on. With HBO being used for more and more conditions, how do you think the way we manage medications personally might need to change to make sure everything is safe and effective when combined with this therapy? And what specific kind of research, moving beyond just animal models, do we really need to untangle these complex interactions in us, in humans? It's a really fascinating crossroads of pharmacology, hyperbaric medicine, and definitely something worth keeping an eye on.